I'm going to be doing a sterile technique with a wound irrigation it asks us to do. So first thing, I'm going to make sure it's the right patient by asking them their name and date of birth. I'm going to be explaining the procedure to them, and if I do need to, I can administer some pain meds. 30 to 45 minutes prior to the procedure, I will give them an explanation of what the expected outcome is. And I also look in their history to make sure that they are not allergic to anything. So before the procedure, I'm going to put on a pair of clean gloves. And what I want is to remove the old dressing. And when I do that, I want to notice if there's any odor, the presence of any exudate. I want to make sure that, I want to note the amount, consistency, and color. And just have a look at the wound base, see if there's any necrotic tissue or slough. That could be just some dead white blood cells, some other dead tissue. So I can remove that, and then I'll remove these clean gloves and put them in the garbage. So now that we got that all sorted out, I can go ahead and grab what I need. Since this is a sterile technique, I will want to keep my hands above my waist, or keep them up. Okay, so then I will wash my hands. I'll make sure my hands are all washed. Remove this. Only touching the border, like so. These are still sterile. Now it depends on where the wound is. I can use what they give me in here is this is a sterile tissue. I can put that where it need be, but I can just throw that in the garbage without touching the garbage can with the tongs. Now, so put that to the side without touching the border. So now that process is done, I could throw those out. So for my saline, if I had to irrigate the wound, I would start at the top with my saline and work my way down. And I'm going to do that until I see a clear fluid draining. So with my saline, I'm going to open that up and I could pour that in like so. And now I can put my sterile gloves on. So I'm going to carefully grab the lip like so without touching, like that. And then I could grab the inside of this glove, like so. So now that I got the sterile gloves on, I can grab my 4x4 gauze. I can use these gloves because they are sterile, and grab it like so. The tongs are just kind of important when I'm trying to keep the sterile technique. So I soak it in the solution, and then I could wring out the gauze just so there's not excessive drainage. And then I'm going to start from the inside and work my way out, and I'm not going to lift up on the gauze. And then when I'm done with that, throw that out, and I would continue that procedure until I'm happy with it. And I would do the same process but with dry gauze at this moment. So I'd do that again, same process while keeping my hands up, tweezers down. Keeping the tweezers down at all times.